So without further ado, we'd like you to, take the floor and do justice to this pertinent issue that we are looking at right before us. Prostate, a friend or a foe? Thank you so much, Dr. Tim. Over to you, sir.
Thank you, Dr. Yewande.
Yes.
I'll be giving this topic, prostate, a friend or a foe. However, before I start, I want to acknowledge, I don't know if it's in this group now, my boss, Emeritus Professor Mbon, who introduced me to this team, the teacher of teachers. You cannot write about urology without talking about Emeritus Professor Mbon. I don't know if he has joined. He's supposed to have joined. He introduced me to this group, and then through Dr. Iguilo. Well, so we'll move into the midst of the day, which is prostate, a friend or a foe. I hope you can hear me. Can you hear me?
Can hear you, sir.
Loud and clear, sir. We can hear you loud and clear, sir.
Lovely. So I'll be giving this topic. I want to make it as simple as it can be, because when I was told to give this lecture, I asked what my audience like. So when I was told about my audience, I wanted to make it like the simplest thing it can be, so that the people can understand what we're discussing. Prostate is a very, very common thing worldwide. It's not only in Nigeria. So of course I've been introduced. So yes, this is a lecture. I understand this happy people group stroke power team. Fine. This is my lecture objectives. At the end of this lecture, I hope that you know what the prostate is. Then prostate as our friend, prostate as a foe, causes of these problems with the prostate, how prostate problems present, differential diagnosis, that is, other things that can mimic, that can pretend to be prostate, and then find complications of the prostate diseases. Then to dispel some myths about prostate diseases, the treatments depending on what we have, and then know how to do a proper check for cancer of the prostate. So this is my learning objective, and I hope that at the end of this presentation, we would have been able to at least say something about the things I've listed. By way of introduction, the prostate gland is important to man. That we'll understand in the course of the discussion. However, prostate diseases and their pathology are some of the commonest disease entities in men. Prostate cancer is the commonest cancer in men world over after skin cancer. Now, the prostate diseases, there are about 3 of them, as we'll get to know in the course of the discussion. Now, at 60 years, up to 50% of men have the benign form of the prostate enlargement, while at 85 years, up to 90%. So this shows us how common prostate diseases can be. It's commonest amongst African Americans, where you have up to 249 per 100,000 men having prostate cancer. The lowest incidence is amongst the Asians, where you have just about 1.9 out of 100,000 men. Now, one might now wonder, why is it low in Asia? Why is it common amongst African Americans? Now, the major thing amongst these two groups is mainly diet. Asians are mainly vegetarians, while African Americans eat a lot of junk food. Billions of dollars are spent every year on researches concerning prostate cancer. It's a global problem everywhere in the world, not only in Nigeria. Now, how is prostate our friend? Now, the prostate gland normally surrounds the urethra. The urethra is the tube through which urine comes in men. This tube. This is the prostate gland. This gland we're looking at is the prostate gland. It helps in giving, or rather producing sperm. It gives us about 1/3 of the semen volume. The sperm volume we see as men, 1/3 of it is supplied by prostate gland. The prostate also supplies some agents, zinc, citric acid, which helps to nourish the sperm. Now, if we note, the sperm is often sticky and thick when it is released. The aim is for us to be able to shoot it like a bullet into the posterior vaginal wall. There is an agent produced by the prostate, because if you leave the sperm sticky and thick, the spermatozoa, which is the sperm cells that should go and fertilize the ova in women, will not be able to happen because they will stick to the agent you've released. It is the agent we call PSA, prostate-specific antigen. It's an enzyme that helps to liquefy the sperm so that the spermatozoa, the sperm cells, can swim to go and do fertilization. So this is the job of the prostate gland. Without this, there's a problem with fertility. So this is our friend. However, as we age, the prostate size increases in size. That's when it becomes our foe. The prostate size increases in size, gets bigger. As it gets bigger, it squeezes and blocks the urethra. Now, this is a schematic diagram I've drawn. If we look, this is the kidneys. Through the tube of the kidneys, urine gets into the bladder, and then when one feels like voiding, it goes through the bladder outward. This is a representative of the prostate gland. As we age, the prostate gland starts to increase in size. As it's increasing outwardly, it's also increasing inwardly. As it's increasing outwardly, it's also increasing inwardly. By so doing, blocking the channel through which urine should flow. That is the problem of the prostate. Now, there are three major problems of the prostate that can bring about this blockade. One is prostatitis, just prostatic infection. The second one is ordinary growth of the prostate, we call benign prostate enlargement. And the last one, which is what we don't like having, is cancer of the prostate. Whatever the prostate problem is, must be one of these three. So once the prostate increases, it blocks this lumen, and the increase can be brought about by any of these three. The increase in size, like I had just explained earlier, could be from prostatitis, from benign prostate enlargement, or from the prostate cancer. The same diagram. This is a normal prostate. You can see the normal opening through which urine should flow. This is the normal opening through which urine should flow. As the prostate increases, like on the right hand of our screen, we'll see that it has blocked this urine flow. Urine comes and bounces back. So flow is distorted. This is one of the things, the ways whereby prostate disease affects us. What is the etiology of this prostate problem, the prostate enlargement? What causes, what brings about the infection, the cancer, and the likes? Sincerely, like I said earlier, they vary depending on what the etiology is. Is it the infective one? Is it just the enlargement? Is it the cancerous type? However, most of the causes of this enlargement, or rather, what brings about the cancer in prostate cancer, or what brings about the enlargement in prostate cancer, is unknown. What we know mainly are things that will predispose us to having them, things that we call risk factors. We cannot technically say they are causes because of the fact that if you expose everybody to it, they might not come down with cancer or the enlargement. So we are now saying the actual etiology of cancer of the prostate, the actual etiology of the ordinary enlargement is not known, but there are risk factors as I will itemize in due course. For the prostatitis, this is just mere prostatic infection. It means infection, and it's commoner with younger men, 40, 50 years. It is not the regular toilet infection we hear from the normal parlance amongst the people on the road. It's the infection of the prostate. There are things that can predispose to it. Now, we move to ordinary enlargement of the prostate. One of the major risk factors for the ordinary enlargement is age. It is often not common to have enlargement of the prostate in men that are less than 40 years. At 60 years, up to 30% of us have prostate cancer. That means if you get men that are up to 60 years, 100 in a room, 30% of them will have prostate enlargement. At 80 years, 100 men in a room, 50 of them will have prostate enlargement. So age is a risk factor. The older you are, the more the risk of having benign enlargement of the prostate. The other one is familial. Some run in the family. I have had a family of 5 boys, and I've had to do surgery for up to 4 of them. All of them had enlargement of the prostate. It's just remaining the last born, and he's already having symptoms. We might have to operate on him very soon. A family of 5 boys. So in about 15% of the times, prostate runs in the family. Then the next thing is our diets. I will explain some of these diets as we go on. Then diabetics. It's been found that prostate enlargement is commoner in people who are diabetic. We don't know if it's the diabetic itself or is it the drug they take that brings about the prostate enlargement, but we found out that it is commoner in people who are diabetics. Heart disease and patients on beta blockers like amlodipine, nifedipine have been found to have more enlargement of the prostate than the ordinary public. Then the lifestyle. Obesity increases the risk of prostate cancer, while exercise can lower your risk factors. Etiology for prostate cancer. This is what we dread most. This is the biggest foe amongst the diseases of the prostate cancer. Like I said earlier, the actual etiology is not known, but we know things that will increase our risk factors. No female will develop prostate cancer because they don't have prostate gland. So prostate is a disease of the males. The fact that we are males is a risk factor for us. Now, age. The older you are, the higher the risk of prostate cancer. Race. It is commoner amongst Black men. And I've told us earlier that it is commoner amongst Black Americans. And it's less common amongst Asians, especially because of the fact that they are vegetarians. Those who eat a lot of red meats, especially when those meats are grilled, are predisposed to having prostate cancer. There's an agent we call heterocyclic aromatic amines or polycyclic aromatic hydrocarbons. These are agents released when we expose meat to raw flame. When we grill meat, it releases some agents, these 2 agents, that predispose us to having even colon cancer, prostate cancer. The bigger or the more obese you are, the fatter you are, the more obese you are, the higher the risk of developing prostate cancer. When we eat a lot of burnt or charred food, grilled, smoked, or pan frying of meat, we have the risk of developing prostate cancer. And like I had said earlier, prostate cancer runs in the family. Up to 15 to 20% of the times, those who have prostate cancer also have prostate cancer in their family lineage, maybe their father, their siblings, their uncles. These are the things that will predispose us to having prostate cancer. Now, what are the things that can reduce the risk of prostate cancer? Eating a lot of fruits and vegetables. What type of fruits? Tomatoes. It releases some agents we call lycopenes and beta-carotenes. These are antioxidants that protect us from most cancers, including prostate cancer. Carrots. The normal carrot we see on the road protects us against most cancers. Soya beans. Use of green tea is protective against prostate cancer. And there are some fruits like pomegranate seed, broccoli, and then fish like mackerel. These things have been known to reduce the risk of prostate cancer. Now, on the left of our screen, this burger, this is grilling of meat on flame. Now, what really happens as we grill this meat, the fluid from the meat drops into the raw flame, turns into smoke, releases the HCA and then PAH, the agent I told are carcinogenic. They get attached to the body of this meat. As we consume this meat, we're exposing ourselves to prostate cancer. On the right of our screen, we'll see mainly fruits, pawpaw, pomegranates, carrot, and the like that I had mentioned earlier. All these things are mainly protective of prostate cancer. Most of these fruits are protective against most cancers, not only cancer. So what are we saying? We should eat healthy, less of red meat, less of grilling, less of smoking, more of fruits, more of exercises. Now, these are agents that are common in our environment. Avocado pear, carrots, tomatoes, they are common in our environment. We're encouraging us to take more of these agents. They help protect against most cancers, including prostate cancer. This is broccoli leaf. It's actually scarce in our environment. It's available but scarce. I bought them from what we call Stanel in my own area before, these big shops. They are highly rich in antioxidants that protects us against prostate cancer. These pomegranate seeds, if you take more of them, you are protected against prostate cancer and other cancers. Exercise. Now is the area when we enter one, we never trek around, we just enter from one vehicle to the other, one bus to the other. Brisk walking, we mustn't jog. Swimming, 30 minutes per day, up to 150 minutes per week is protective against most cancers of the body. Protects you against cardiac arrest and the likes. So we're encouraging all of us to do a lot of exercise, 30 minutes per day. Just do brisk walking around your house, around your environment. Use more of trekking than more of your cars. These have been known to protect us against most of these things. What is really cancer? Why are we afraid of cancer? Cancers are abnormal, uncontrollable, excessive tissue growths. That is to say, like our finger. The normal thing is that the finger grows to a particular size and stops growing. But if it is cancerous, it will continue to grow until it even gets bigger than the person who owns the finger. That's what makes it cancerous. But why are we bothered about it really? As the cancer continues to grow, as that organ of our body continues to grow, it starts to compete with our normal body for space, for food, and for water. All it means is that, let's say you take 1 cup of rice. Cancer will take like 50% of that rice while you eat 50%. Over time, the cancer will continue to grow. When you eat 1 cup of rice, cancer will take 70% and you will take 30%. And over time, it will consume the entire food until it kills the patient. That is the fear we have of cancer. Apart from this, it also spreads to other parts of our body. It also competes with us for space and for water. In addition to this competition with space and water, prostate cancer generally, cancers release toxins. These toxins make us weak. It makes us emaciate. It makes us not feed well. And over time, the patient finally dies. That is the fear for cancer. How do people with prostate disease present? That is to say, if you have any of these 3 pathologies I've mentioned, prostatitis, ordinary enlargement of the prostate, or cancer of the prostate, how will you present? 1, feeling face problems, nocturia. You start waking up to more than 2 times at night to go and pass urine. A normal individual is not supposed to wake up more than twice at night to go and pass urine. Some will even say once. But we'll allow people who wake up at least twice, or rather, at most twice in the night. Once you wake up more than twice in the night, there's a problem somewhere. Frequency of micturition. When you go to pass urine more than once in 2 hours, you have a problem with passing urine. Urgency. Where once you feel like passing urine, before you get to the place, you start leaking some urine. You were like, look, I want to go and ease myself. Before you get there, you start wetting yourself a bit. Urgency, incontinence, and then bedwetting for mainly the elderly, where the bladder becomes so full that it starts leaking on its own. You find an old man or an elderly man who now starts bedwetting. These are signs of the fact that there's an obstruction somewhere, and this is most likely prostate in that age. The other symptoms we call voiding face symptoms are 1, hesitancy, where you want to void, you have some delay before the urine starts flowing. When it starts flowing, the stream is weak. You remember when we were in school, we could raise the stream of our urine to hit the ceiling. As you age, the stream starts dropping. Over time, it becomes so weak that you have to strain to pass urine. Whilst you are passing urine, it comes out, it breaks, it continues. That's what we call intermittency. And at the end, when you finish passing urine, you fling your penis and then tuck it in. You still be having some droplets on your panties. These are all evidence of the fact that, look, there's a problem with your prostate. There's also what we call feeling of incomplete bladder emptying. Occasionally, after emptying your bladder, you look as if, look, I still have some urine in my bladder. And then finally, total blockade. that happens when you delay passing urine. Those who are in board meetings, those who take alcohol and the likes, they could just often a time just have total blockade of their urine and they can't pass urine, following which they will rush to a hospital and a catheter will be passed to relieve the obstruction. Other problems that can arise when you have enlargement of the prostate are: one, abdominal fullness. Early morning facial puffiness, where you have swollen face, especially when you wake up at night. These are signs of the fact that, look, it has started affecting your kidneys. Headache, leg swelling, especially when it is unilateral leg swelling. One side is swollen, the other one is not swollen. Blood in your urine or blood in the sperm. This may be signs of the fact that you have cancer of the prostate. It is not absolute. These are just signs that we'll look out for. Dysuria, when one is passing urine, you have some pain. There are some that are specific to cancer of the prostate because these other ones I've mentioned are general to the three pathologies that can happen to the prostate. Like I said earlier, it could be prostatic infection, it could be ordinary enlargement of the prostate, it could also be cancer of the prostate. But there are some things that are specific to cancer of the prostate. Low back pain. You have bone pain. You suddenly start losing weight. Leg swelling, especially when it's asymmetrical. Your right leg is swollen, your left is not. Anorexia, when the cancer cells release toxins, you start having anorexia, you won't be able to eat. If nothing is done, you see people who come in unable to walk, inability to walk. Some come down with problem with erection. These are all signs of the fact that there's a problem with the prostate. Now, whilst I was listing all these problems, I know most people would have said, I have this, I have that. There are some other things that can mimic, that can present or pretend to be prostate disease. One of them is what we call bladder neck stenosis. For those who also have bladder tumor, who have some of these problems I've listed, urethral stricture, which happens mainly in younger people, who also present the same way, those who have bladder stone. But there are things that are common even among the general society. Often a time, people will come and tell me, look, they have prostate disease from what their friends told them. When you query them, you find out they have one of these other three. People who have diabetes also void regularly. They have frequency and the likes. So it almost lies on the clinician to find out, is this patient diabetic? Is he taking his drugs? Is it properly managed? Then you now know if it is prostate or diabetes. Also, who are hypertensive and are on some diuretics, drugs that make us pass a lot of urine, that also help us to control our hypertension. They also pretend or rather mimic prostate disease. And then the commoner one amongst the general public now is water therapy. They say take a lot of water, you flush your kidneys and the likes. The more water you take, the more urine you will pass. So it's like garbage in, garbage out. So some will rush and say, look, doc, I'm waking up like 4 or 5 times at night to pass urine. Say, how much urine do you take before you go to bed? Say, look, I take up to 2 or 3 sachets of water. That's the reason why you're passing too much of urine. So it's not your prostate. But of course, when you have any of these symptoms we've mentioned earlier, one should see a clinician to assess and decide if it is the prostate or any of these other differential diagnoses of prostate disease. What are the complications of prostate disease? Let's say you develop these things, you do nothing about them. 1, you could have sudden inability to pass urine. All of a sudden, your urine was blocked. You'll be in pains. You want to pass urine, you won't be able to pass urine. 2, recurrent urinary tract infection. 3, kidney failure. Because, if you look at the diagrams I had shown earlier, the prostate blocks the outflow of urine from the bladder. The bladder gets so full that it starts returning pressures to the kidneys. By so doing, it starts damaging the kidney. So you see somebody presents to you with puffy face and the likes. That means the patient is now having kidney failure from prostate enlargement. We could have formation of bladder stones. We could have bladder damage when it becomes so distended that it will not be able to push out urine again. And then if it is cancerous, you can have spread to other parts of the body, and finally, death if nothing is done. Now, like I said earlier, this bladder gets filled, and then urine starts going back to the kidney, and the kidney becomes enlarged. Same thing this way, the patient will of course develop damaged kidneys and then failure of the kidneys. These are some of the stones I retrieved from some of my patients that have prostate enlargement, stone in the bladder from prolonged difficulty with passing urine. These are some of the stones I retrieved from some of my patients. These are also some stones. In fact, this one is even a medical doctor. Developed prostate and was afraid for surgery and developed all these stones. These are all stones in my own patients I managed. What investigation should be done when you develop or you suspect one has prostate enlargement or disease? One, kidney function test. Of course, remember we said if nothing is done with enlargement, there's distension of the bladder and damage to the kidney. So one of the things we want to confirm is this patient's kidney still functioning well. We do what we call abdominal ultrasound scan or transrectal abdominal ultrasound scan. There's an ultrasound scan we put through the anus to check the health of the prostate, the size of the prostate, and then is there a stone in the bladder, is there a diverticulum and the likes. These are things we'll find out by doing ultrasound scan. We do urinalysis. We want to know, is there infection? Is this patient diabetic? There are lots of things we can find out from our urinalysis. Is there a damage to the kidney? It will help us decipher those. Then there's this very important one we know. Actually, I believe most people in this group will know. There's something we call prostate-specific antigen. This is one of the things produced by the prostate in normal health. Also, as the prostate gets diseased, the secretion of prostate-specific antigen also increases. So it's one of the surrogates to check the health of the prostate. When the prostate-specific antigen is enlarged or rather increased, we advise patients to go for prostate biopsy. Prostate biopsy is what we must do if we suspect prostate cancer, because there is no other way one can find out if one has cancer or not. Then, of course, if we suspect you have cancer, there are other things we can do, isotope scan and then MRI. Recently, MRI have been found to be very, very important. In fact, what we now do is what we call multi-parametric MRI. This helps us to tell the likelihood of one having significant or important prostate cancer. Some prostate cancer could be present and nothing will happen to the patient, while some could be present and something would, of course, are very aggressive. Multi-parametric MRI have been found to be very useful in doing this, and it's one of the things we use lately, or rather recently, to check if one should go ahead to do biopsy or not, depending on the PSA and the likes. What are the myths about prostate cancer or prostate enlargement? Some patients will have markedly increased PSA, and you tell them you want to do prostate biopsy. They'll say, they heard that if you do prostate biopsy, the cancer will start spreading further. There's nothing like that. Scientifically, it's been proven this does not bring about spread of prostate cancer. Biopsy does not bring about spread of prostate cancer. Most people are afraid because there is no other way you can tell if one has prostate cancer or not, except you do a prostate biopsy. And of course, the treatment for prostate cancer or other prostate pathologies are life-changing. They are not things you want to do for a patient that you have not confirmed has the pathology you are managing. So first thing is to confirm what you want to manage, and you go ahead to manage. The other thing I want to say is that BPH, which is benign prostatic enlargement, does not lead to prostate cancer. Some will go to do mere ultrasound scan, and they will tell them their prostate is enlarged. They will call you, doctor, please, I was told my prostate is enlarged. Please, I want it removed before it will turn to cancer. There is no connection between ordinary enlargement of the prostate and prostate cancer. Enlargement of the prostate does not lead to prostate cancer. So even removing the prostate, the benign prostate, does not mean one cannot develop prostate cancer. BPH does not increase the risk of prostate cancer. Then there's this very common one most young men would call to ask. They heard that the more sex you have, the less the likelihood of developing prostate cancer. Cancer of the prostate is not related to too little or too much of sex. Many young people, well-to-do, will call me, please, doctor, I heard that more sex, no prostate cancer. It is not true. Bringing down PSA is not synonymous with disappearance of prostate cancer. Some will go for a test that will tell them, look, oh, their PSA is, let's say, 100. And they will go and start taking drugs to bring down the PSA. Bringing down the PSA is not synonymous with disappearance of prostate cancer. One is only deceiving oneself if you go to do that. Once your PSA is high, meet a urologist to assess you and decide if you go for biopsy to confirm whatever you have. It may well not be prostate cancer. It may be just ordinary infection of the prostate. It may be well ordinary enlargement of the prostate. Let a urologist assess you and decide what to do before you start taking drugs to bring down your PSA. Bringing down PSA does not treat cancer of the prostate. That's not the way we manage it. Treatment. How do we treat the prostate pathologist? Prostate treatment, or rather treatment of the pathologist, depends on what the patient has and the stage of the disease. For prostatitis simply means ordinary infection of the prostate. You give antibiotics for a long duration of time, 4 to 6 weeks. For ordinary enlargement of the prostate with urinary symptoms, we'll give drugs. Where drug does not work or the patient is not tolerating the drug, we do a few procedures like TURP, laser, or open surgery, depending on what one wants and what is available in your locality. For cancer of the prostate, treatment depends on whether it's early stage or late stage prostate cancer. You could do surgery, we could use drug for hormone or radiotherapy. Any of these things depends on what the patient has. Then you now know what to apply for the patient. Now, this is the prostate gland that I removed in one of my patients like about 10 years ago. This is how big it has become, and the patient came in retention, couldn't pass urine. After assessment, and it was not cancerous, we removed the prostate. This is the way the prostate appears when you bring it out by open surgery. This is also one of my patients who presented, of course, with blockade of urination. This is minimal access, no knife cut on the skin. We do what we call TURP, transurethral resection of the prostate. We'll chop the prostate into bits and then we'll evacuate it through the penis. No knife cut through on the patients. Screening, please. If there's something we must leave these lectures with, it is this page. From 40 years, if you have a family history of prostate cancer, that is the brother, uncle, or father, one must start screening for prostate cancer. From 40 years. If there is no family history in that patient, we advise patients from 45 years upward to start screening for prostate cancer, especially when we are blacks. For men who are above 70 years, there is no need for screening of prostate cancer, especially when the PSA at 70 years was good. There's no need for this, there's no longer need for screening. Patient will probably would not need PSA screening again. But of course, like I said earlier, those who have family history from 40 years, those who don't have family history and are blacks from 45 years are advised to go for prostate screening. Most guidelines lately advise that patients should have informed consent on what prostate screening is, what to do next if it comes out positive, what to do if it comes out negative. What do we really do when we want to screen patients for prostate cancer or prostate enlargement? Just once every year, one should do what we call prostate-specific antigen, PSA. They will collect your blood, and within 1 week, result will be out. If it is good, the normal value is 0 to 4 nanogram per mil. However, even if it is, say, 7, there are other parameters I will look at to know if I want to go ahead to do biopsy, I want to leave the patient. Is this patient above 70? What is the size of the gland? If the man has a gland that is about 200 grams, I will not bother him with PSA of 7 nanograms per mil. So first is to present yourself once every year for prostate specific antigen screening. They will collect your blood and do it and go for interpretation by the urologist. Then there's what we call digital rectal examination by a urologist. You come to the clinic, we stick in our finger, index finger into the rectum, and then we'll palpate the prostate gland, assessing some features that by our training. By so doing, we're able to assess the health of the prostate. This is what it means to do prostate screening once every year. It's not up to 20,000 to do all this. PSA, digital rectal examination by a urologist, of course, you pay the consultation to the urologist. In conclusion, prostate cancer is currently a public health problem. Generally, prostate problems are public health problems. Early diagnosis is our only hope for cure, especially for prostate cancer. If you find prostate cancer early enough, you can get cure and live your normal life. However, unfortunately, most patients in our climate present very late. Like I said earlier, the normal PSA is 0 to 4. It could be more than that. With interpretation, we'll know who to biopsy or who not to treat. But some patients will present when their PSA is over 1,000. In such patients, you cannot achieve cure again. So we advise us to do early diagnosis by virtue of going for yearly screening, especially when you are less than 70 years. There is increased awareness of prostate enlargement and prostate pathologies. So of course, this has predisposed the general public to fraud about prostate diseases. Please be aware. Thank you for listening.
Yes, thank you so much. Help us also with the nutrition aspect, because even doctor was saying that maybe you throw more light in that area, because questions were, what can cure it? Is there any curing process? Is there any supplementation? Just help us in that line, sir.
Generally, okay. Well, you know, the thing there is, we heard when doctor also affirmed that a lot of phytochemicals are essential in management and prevention of prostate issues. And amongst these, he mentioned something that had to do with pomegranates. And over here, we have a product called RG Plus. It contains pomegranate in there. So you can see that the Forever Living product has this, and it has a lot of health benefits as well. And it's fully packed with antioxidants that prevent the side effects that doctor mentioned with regards to aromatic cyclic hydrocarbons that are often present when people expose things like meat to raw flame. And remember, he also emphasized that that could be a risk factor with regards to developing prostate cancer. He also mentioned the use of vegetables like broccoli and all that. And we have a package here well stocked with all kinds of vegetable nutrients that we need to take care of that aspect that doctor mentioned with regards to prevention and or management of prostate issues. We also have this product here that contains cranberry extract, as well as aloe gel, which actually is an adaptogen and adapts situations back to normal. And it also, that cranberry extract helps us to prevent the attachment of bacteria to the urinary tract. You can see where doctor was extracting some stones that were in the bladder of the patients that had prostate issues. And you can also, that means in that area, bacteria can also attach themselves to such areas and also trigger things like urinary tract infections. This is our popular product called aloe gel. It's also found in here, but in this one, we have an extra, which is the cranberry extract that actually helps with resolving these issues. Doctor also mentioned lycopene, because lycopene is actually a very, very wonderful antioxidant that has been proven to help with regards to shrinking of prostate issues, prostate size, especially in cases with regards to benign prostatic hyperplasia, as he mentioned earlier. This is our vitalized men. It contains lycopene, and this lycopene is very essential with regards to prostate issues. If we remember, when he was talking about the content of the prostate fluid, he also mentioned that there was zinc present, and there is a lot of zinc here, as it is established that zinc is very essential for prostate health as well as immunity. In cases where people are having things like prostatitis, which is secondary to infection, we have B propolis tablets here. This B propolis tablet you are looking at here is actually natural antimicrobial agent and is very effective against viri, fungi, and bacteria. This Fields of Greens is a younger cousin of the super greens, and it also contains a lot of nutrients and nourishment that are essential, especially sulfonophene, which is one of the powerful antioxidants that doctor was also talking about. Remember, he spoke about free radicals that are associated with roasting of meat in raw flame, and we have this absorbent C, which is in form of L-ascorbate. This is different from the regular synthetic vitamin C because the ascorbate form is actually better absorbed by our system and is a powerful antioxidant to counter these aromatic hydrocarbons that are found in our roasted meats, like that of suya that he was talking about. This B proline is packed full with nourishment for the prostate to ensure proper development and sustenance of very beautiful prostate cells that will be resistant to issues like prostate cancer. Lycium here contains very powerful antioxidants, even more powerful than the ones we know regularly, and it is known to have very potent action against cancer generally. Now, this multi-marker basically is involved in regulation of sexual hormones, and hence is essential with regards to some issues that may arise as a result of prostate issues leading to sexual dysfunction. You know, someone was asking questions about sexual performance and prostate issues, and you can see that it's a very, very crucial matter that a lot of men consider to be important, and hence this multi-marker is something that will help to resolve whatever issues that are coming up with regards to sexual dysfunction. The immune system is very essential with regards to protecting the prostate cells from attack by pathogen, external factors like bacteria and other stuff that may lead to prostatitis. And we have this immune blend to help us. We have a lot of products that will help with prostate health. And because of time, we may not be able to talk about each and every single one of them one by one. But from the little that has been shown here, you see that Forever Living product is actually well equipped to help with regards to the nourishment aspect that will help with the prevention and or assisting in management of different types of prostate issues. Thank you very much. I appreciate it.